I call to order the second informal meeting of the plenary on public health crisis emanating from Ebola virus outbreak. As noted in my letter dated 11th November 2014, I have invited Mr. Anthony Banbury, Special Representative and Head of the United Nations Mission for Ebola Emergency Response, and me, to brief the membership. I take this opportunity to warmly welcome our distinguished guests to this meeting. Major General Julius Oketa, Head of the African Union Support to Ebola Outbreak in West Africa Cooperation, SOA, and Major Alfred Para Conte, retired Chairman of the National Ebola Response Committee in Sierra Leone, are joining us via video conference. The report on the work of the United Nations in response to Ebola outbreak covering developments from the 19th of September 2014 has been circulated in document A/69/573. The report records the activities carried out by the Special Envoy of the Secretary General on Ebola and the United Nations Mission for Ebola Emergency Response, UNMIR, as well as progress in the Ebola response pursuant to the decision of the Secretary General and in furtherance to Resolution 69/1 of 19 September 2014. Your Excellencies, Ms. Susan Marcola, Secretary General's Chief of the Cabinet, Mr. Anthony Banbury, Special Representative of the Secretary General and Head of the United Nations Mission for Emergency Response, Ebola Response, Dr. David Nabarro, Special Envoy of the Secretary General on Ebola, distinguished delegates, ladies and gentlemen. Since our last briefing on this matter, slightly over a month ago, we have seen some important progress made against the unprecedented outbreak of Ebola. We extend our solidarity to the governments and people in the affected countries and commend them for their gallant efforts and measures taken towards combating the disease. Our deep appreciation also goes out to the African Union and international community, which has risen to the occasion by pledging critical resources to support the Ebola response. We also commend the heroic efforts of the non-governmental organizations, medical and healthcare staff, many of whom have been on the front lines since day one. I'm pleased to note that due to these collective efforts, there have been important improvements on the ground. The United Nations First Emergency Health Mission, NMR, has deployed crucial resources, supplies, and people to the most affected areas in West Africa. The presence of foreign health workers and the establishment of UNMR have made a difference, while additional treatment facilities have been set up and staffed. Targeted outreach campaigns are reaching more communities, including those in remote areas. It is now essential to scale up these critical steps towards stemming the outbreak through a systemic, coordinated, and sustained approach. Excellencies, the current trends regarding the spread of Ebola remain complex, and the overall picture is still troubling. In some areas, the number of new cases is slowing down, yet total numbers of cases across the region remain high. A recent spike in new cases in some specific locations is of great concern. The resounding message from those in the hardest hit areas is that while we are making encouraging progress in combating Ebola, we have not yet won the war. We must do more to ensure that the momentum is sustained and that critical resources reach those in urgent need without delay. More specialized healthcare workers are urgently needed on the ground to work side by side with national health care staff. There is urgent need for more Ebola treatment centers and units, reliable data, and greater coordination among all partners involved in the response. Strong efforts must also be taken to avoid stigmatization. In this regard, it is essential to put into place proper screening procedures rather than blanket measures such as travel bans and restrictions or quarantines based on fear or panic. Survivors and healthcare responders should be embraced. Beyond the immediate challenge of the current crisis, there is also a need for greater focus on the recovery from this epidemic. Recovery efforts will certainly be long and arduous, as the outbreak has impacted all facets of everyday life and in the affected countries. Schools in many areas have been closed for nearly a year. Food production has sharply declined. The number of children orphaned by Ebola is staggering, and the economic impact of the crisis is enormous. The future of the healthcare system in the affected countries is of particular concern. The epidemic has devastated weak healthcare systems. Increasingly, people are dying of illnesses such as malaria and tuberculosis as scarce resources are diverted to Ebola response. A strong commitment will be needed from the international community to not only contain Ebola, but also prevent other health emergencies. Strengthening the healthcare system in the affected countries must be a top priority in our recovery efforts. Ladies and gentlemen, despite the progress that has been made, now is not the time to become complacent. In this regard, I intend to convene regular briefings on this matter. The international community must remain seized and continue to provide the much-needed support for combating this disease. Even as we sit here today, many people in the affected countries are losing the battle against Ebola. This epidemic is far from contained. We must stay vigilant and committed to stopping this scourge. We cannot afford to take our eyes off this crisis and must remain focused until the job is done. Together, let's redouble our efforts to bring this sad chapter in human history to an end. I thank you for your kind attention.